This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, May 6th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. The coronavirus pandemic has stifled global economies as governments told people to stay home in order to prevent further spreading of the virus. But the White House is planning to shut down its COVID-19 task force as the number of new confirmed cases in the United States continues to rise by more than 20,000 per day, and daily death toll sits between 1,000 and 2,000 people. U.S. Vice President Mike Pence says the administration is considering the end of May or early June to shift management of America's response back to federal agencies instead of the task force. The United States currently has 1.2 million confirmed coronavirus infections and more than 71,000 coronavirus deaths. Worldwide, there are more than 3.6 million COVID-19 cases with over 255,000 deaths, but more than 1.1 million people have recovered from the disease. There is no current cure for COVID-19, but the U.S. Food and Drug Administration is authorizing the use of a drug used in Ebola patients for emergency use to treat those hospitalized with COVID-19. Remdesivir manufacturer Gilead Sciences has announced that it is discussing with pharmaceutical companies about producing the drug for those in Europe, Asia, and the developing world. A U.S. trial shows the drug spared recovery time for coronavirus patients by about 30%. Now to Africa, where South Africa's National Treasury says due to the effects of COVID-19, its gross domestic product could decline by as much as 12% this year, with manufacturing, mining, and services likely to be the worst affected sectors, according to Reuters. The disease has infected more than 6,000 South Africans and killed at least 120. In South Sudan, aid agencies are racing to prevent the spread of COVID-19. Although there are 35 confirmed cases of coronavirus, many of the nation's 1.7 million internally displaced people are living in poor sanitary conditions with limited or no access to health facilities. Many of the country's health facilities were damaged or destroyed during years of civil war. Any remaining facilities lack sufficient medicines, qualified health professionals, and medical equipment. The chief advisor to the World Health Organization's Director General, Dr. Sinead Fiseha, says the world needs U.S. leadership in the fight against coronavirus now more than ever. She called for the U.S. to rethink its funding suspension and asked world leaders to remember that during this pandemic, we are all in this together. VOA Salem Solomon spoke to Dr. Fiseha and has this report.
U.S. President Donald Trump has ordered his administration to halt funding for the World Health Organization. He accuses the organization of doing the bidding of China in the battle against coronavirus.
We give $500 million. We have over the years from 400 to 500 for a long time, for many years. And China is giving $38 million. And yet they seem to work for China. And they should have been in there early. They should have known what was going on. And they should have been able to stop it at the...
But Dr. Sinead Fiseha, a chief advisor to the WHO's Director General, says to move forward with the decision is devastating and that the U.S. should rethink the move.
Where we're going to feel the pinch the most is going to be around routine services like immunizations, life-saving interventions that the WHO provides in collaboration with national governments. So this is not good news. Of course, the decision is not final.
She says it is disastrous to make this move in the middle of a pandemic. The WHO is providing global surveillance of the spread of the disease, coordinating with the international response, and giving advice and training to health practitioners.
The WHO, as well as allies of global public health, continue to negotiate and reach out with the U.S. government to see what can be done to reverse the course. In fact, if anything, this is the time where U.S. leadership is enormously critical globally, and not only we expect and we hope funding will be reinstated, but rather we want to see an increase in funding to fight this pandemic, all in this together.
The WHO has received criticism for early missteps in response to the virus. On January 14, the organization tweeted that Chinese authorities had found no evidence of human-to-human transmission of the virus. This proved to be false. The WHO also waited until March 11th to declare coronavirus a global pandemic. By that time, cases had been recorded in 110 countries. Critics say the WHO should have done more to see that China shared its samples of the virus with international researchers.
But the World Health Organization's regulatory arm clearly failed during this pandemic.
But Sun Knight says the WHO seeks to stay out of politics and maintain a relationship with all countries in order to have access to information. She pointed out that early on, the WHO sent a team of international scientists to China to investigate the outbreak. Within 2 weeks of the first public reports of the virus, the WHO was able to share the sequenced gene of the virus, which was used to create diagnostic tools and for research on a vaccine.
And frankly, the world is able to do this only because WHO can coordinate this response. As you know, a lot of countries have bilateral relationships. The United States has a relationship with China, but those bilateral relationships are fraught with a lot of politics. And what the WHO tries to do is stay away from that politics and focus on global public health.
The WHO Director General, Dr. Tedros Adhanom, has also been under fire for praising China's transparency in reporting about the virus at a time many believe Chinese officials were underreporting the extent of the outbreak. Republican members of the U.S. House of Representatives have written a letter accusing Tedros of supporting a Chinese propaganda campaign and demanding that Tedros release all correspondence between the WHO and Chinese officials. Sun Knight, who's originally from Ethiopia and has worked with the Director General on public health issues for 20 years, says he is a leader of the highest integrity. She pointed out that during his time as Ethiopia's Minister of Health, he relentlessly worked to decrease maternal mortality, HIV/AIDS infections, malaria, tuberculosis, and mortality for children under 5 years old.
He was highly focused, he was highly precise, he was fantastic in garnering partnerships and collaboration and support.
Sun Knight believes Tedros will weather the storm of criticism and is the right person to lead the World Health Body.
There are going to be critics. It doesn't mean that Dr. Tedros is a perfect person. The good thing about him is he has a growth mindset. He's always willing to learn and grow and improve. But the truth is some of the attacks that have been targeted at him during this time are heavily unfounded. They are very political.
Salam Solomon, VOA News, Washington.
South African engineers and doctors are designing makeshift, inexpensive devices to address a major challenge posed by the coronavirus, the lack of ventilators for patients. South Africa is scrambling for thousands more ventilators as confirmed COVID-19 cases have increased to more than 7,200 with at least 138 deaths. Franco Puglisi reports from Johannesburg.
Ventilators are complex and expensive machines that are badly needed to treat COVID-19, especially in developing countries like South Africa. While South Africa is the most developed nation on the continent, it is also the worst hit by the virus and needs thousands more ventilators. To address the shortage, South African doctors and engineers are teaming up to create inexpensive emergency ventilators that are portable and easy to use.
What we set out to do was originally to have something that is affordable, that is indestructible, and that's obviously pretty cheap. And that's when we set out to actually start with the design on the O2 box.
Developed by Dr. Jano de Beer, the O2 box cost about $220 compared to tens of thousands of dollars for a standard ventilator and can run on solar power, dual voltage, or even off a car battery. But the inventors note the O2 box is not meant to replace a standard ventilator, just to act as an emergency device or last resort.
using that with the fact that it's quite inexpensive, allowing a person that might otherwise not be able to get a ventilator, that because of reasons of not fitting the protocol of age, of disease progress, of prognosis, having that person have a fighting chance with a ventilator that is inexpensive.
A team from the University of Johannesburg is also working on their own inexpensive ventilator that is open source design.
So in that sense, or from that philosophy, the purpose of the university is then almost to form sort of a think tank or an idea innovation hub where we can develop these technologies and send them out into the world where people can hopefully use them.
While still at the prototype stage, De Beer and Hill expect to produce up to 3,000 O2 boxes per week. By the end of May, the emergency ventilators can't come soon enough. South African medical experts say the nation peak in COVID-19 infection could come as early as July or as late as September. Franco Puglisi for VOA News, Johannesburg.
Women rights activists say COVID-19 lockdowns and movement restrictions are creating the perfect conditions for domestic abuse. On VOA's Women Focus show, Our Voices, Heidi Adams-Fitzpatrick looks at how COVID-19 is triggering what some are calling a shadow pandemic.
For many women, the coronavirus lockdowns mean days and weeks in isolation with their abuser. Rights activists say around the world they're seeing a rise in domestic violence. I spoke to Agnes Odhiambo from Human Rights Watch in Kenya, and I asked her about the risks to women's personal safety.
It's a very difficult situation. Domestic violence is invisible. It happens behind closed doors, locked doors. Morning, day and night, you're stuck with your abuser in an environment where there's a lot of stress. I was speaking with someone who works at a shelter for survivors of domestic violence in Kenya. And she gave me the story of this 16-year-old girl who was kidnapped by a man. And this man stayed with her for 4 days before she was rescued by neighbors and sexually assaulted her. And you know, slum areas are very congested, their houses are tiny. And she was saying to me that this is the discourse in the slum areas now, where men are saying that they cannot just stay in the houses bored, and there are all these women, including girls who are not in school. We are fearing that we are going to see very many cases of domestic violence, of sexual abuse, including unplanned pregnancies for girls. I'm based here in Kenya. Government is taking all kinds of measures. I have not seen at any point seen them calling out for public participation into what the government should be doing better. That needs to change, and governments across Africa need to hear the voices of women. But I think this is really a learning moment, and we need to learn and take that on board and move with it even beyond the COVID pandemic.
I asked Agnes what her advice is to any woman who really fears for her personal safety, who might be in trouble and wants to reach out for help, especially as cities, neighborhoods and communities are on lockdown.
Violence is a crime, and if you're facing it, you need to speak out and look for help. In our communities, even in these places, in the slum areas, in the ghettos, they always have a social safety network, and so there's a way of reaching out. For example, in Kenya here, we have what they call gender defenders, who are just women within the community who you have their phone number, you can call and say, this is happening to me, can you help me to get out of this situation? And one of the things we are pushing for and asking governments to make sure they do is to treat services for survivors of domestic violence as essential services. If shelters are not enough, just the way they are finding accommodation in hotels for victims of COVID-19, they need to do the same for survivors of domestic violence, because you cannot stay in an abusive situation. It's a very big risk to women's life and to women's health. And whenever there's an opportunity in your communities to be involved in shaping the actions that governments are doing right now, make sure that your voice is heard. You know, send WhatsApp, send text, call whoever is going there. Make sure that your voice is being heard.
That was Agnes Odhiambo from Human Rights Watch speaking to Our Voices' Heidi Adams-Fitzpatrick from Nairobi, Kenya. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, Uganda's youth join the fight against COVID-19 through technology. We'll be right back after this break. Welcome back to Africa 54. U.S. President Donald Trump visited an aerospace facility in Arizona that is now making masks for healthcare workers after largely staying in at the White House during the pandemic. The visit to this key battleground state is the first in a series of trips designed to highlight Trump's efforts to combat COVID-19, as his administration is dismissing a report predicting a surge in the coronavirus deaths. White House correspondent Patsy Widakuswara has our report.
U.S. President Donald Trump toured the Honeywell Aerospace facility in Phoenix, Arizona, that's now producing masks for healthcare workers.
Various countries have been sent some very bad masks from other places. There's nothing like that at Honeywell.
Arizona is a key battleground state in this fall's U.S. presidential election. This is Trump's first venture out of the White House other than a trip to a presidential retreat and his March send-off of a Navy hospital ship headed to New York. The White House highlights these high-profile events as well as Trump's various roundtables, which some observers say raises questions about what's actually getting done.
What it has been less of is the attention to the everyday operational detail, working in accountability and really closely tracking how much is getting produced in terms of tests and what are the updates about specific amounts that are out in the field and how are they doing and how are they performing? What about personal protective equipment? How much is being put into the field?
Overshadowing Trump's visit, a whistleblower complaint from a top American vaccine scientist, Rick Bright. The former director of Biomedical Advanced Research and Development Authority at the National Institutes of Health said he was demoted after refusing to promote hydroxychloroquine. That's the controversial drug Trump has touted to treat COVID-19 patients.
It would be extremely concerning if our top scientists and doctors in the federal government are not able to do their part and make recommendations based on the best available science and evidence.
Trump is wrapping up the work of the White House Coronavirus Task Force and focusing on the next phase of dealing with the pandemic. USA! USA! He wants states to reopen their economies, showing support for rallies like these, despite a report predicting a surge in coronavirus deaths around 3,000 per day, almost double the current tally.
Those projections are without mitigation. We're doing a lot of mitigation, and we have to keep our country. Our country wants to open.
Patsy Widakuswara, VOA News.
A number of human rights organizations, aid agencies, and former diplomats are calling on the United States to ease sanctions on adversaries like Iran, Venezuela, and North Korea to facilitate medical and food assistance during the coronavirus pandemic. But there's more than meets the eye to the situation. Here's VOA's Brian Pardon.
Iran launched its first military satellite in April in the midst of the coronavirus outbreak, prompting a bipartisan push by 90% of U.S. House members to extend an arms embargo against Iran. However, there are also increasing calls to ease some trade and financial restrictions that hinder Iran's ability to import critical drugs and medical equipment. This as the nation struggles with one of the highest coronavirus infection rates in the Middle East.
I see that as a moral obligation countries imposing sanctions have to minimize the adverse effects of these sanctions on civilian populations.
Venezuela was experiencing shortages of food and medicine even before the U.S. imposed sanctions on its oil industry to weaken socialist leader Nicolas Maduro's grip on power. The coronavirus pandemic has made Venezuela's situation even worse as the collapse of global gasoline prices has decimated oil revenue, the country's economic lifeline. The U.S. State Department offered to lift some sanctions if Venezuela formed a transitional government without Maduro. But Caracas has so far rejected the U.S. offer, and Maduro has indicated he may cancel next year's legislative elections because of the pandemic. In North Korea, neither Kim Jong-un's return to public view after a long, unexplained absence, nor Pyongyang's dubious claims to have no coronavirus cases have eased growing concern that the pandemic is disrupting food supplies in a country already suffering from shortages. Advocates for tough sanctions on North Korea over its nuclear weapons program argue that providing coronavirus aid would allow authoritarian governments to spend more resources on weapons and illicit activities.
If during this virus our sanctions force behavioral change, in that the regimes spend the money they have on their people to fight the virus and not on illicit conduct, that's actually a good outcome for the United States and our national security.
While the pandemic may weaken America's adversaries, Washington is being urged by rights groups and others to balance the need to maintain pressure on authoritarian leaders with the growing humanitarian needs of people living under those regimes. Brian Padden, VOA News, Washington.
In our tech report, young people in Uganda are creating new technologies and applications that are addressing challenges caused by COVID-19. The Innovation Village Business Center offers a co-working space, training, mentoring, and helping entrepreneurs launch their startups. Africa 54's tech reporter Paul Ndiho spoke to CK Japheth, CEO and founder of the Innovation Village Hub in Kampala, Uganda.
Mr. CK Japheth, welcome to Africa 54.
Thank you, Paul, for having me.
How have you been, man?
It's great. I mean, difficult times, but someone said never waste a crisis. So we've been busy trying to understand what opportunities come with the crisis.
How is the tech community dealing with this COVID-19 crisis?
You know, as the tech community, we love to say that we leverage technology to solve our most pressing challenges. So what better way than to be solving for COVID-19? That's what validates us as entrepreneurs. So on one side, we have entrepreneurs that have done really well. They've never seen such growth, especially those that are dealing, have thrived with the low-touch economy, and have been building up e-commerce platforms, distribution of products, supporting other small businesses to get online. Some have even seen their systems break down because of the demand. On the other hand, I think there's a category of others that have actually closed. It's been unfortunate for them, where investors have called back and said, unfortunately, we can't be investing during this period, especially looking at how much time they've already put in. A startup that has been operating for three years had raised, its first round, and the investor calls back and says, unfortunately, I also can't raise money anymore to invest in your next round. As I speak right now, probably grown, over 3,000%. Space is about 5,000 square meters. With about 150 startups in the community solving problems in 10 sectors. We've also recently expanded to build additional innovation hubs in 4 regional locations, especially those that have been building digital platforms for e-commerce platforms to support other small businesses to get online. So as everybody was closing down, these were opening up and also helping other small businesses get online. A young entrepreneur yesterday was telling me that Swipe to Pay, that in just the 4 weeks of lockdown, he had more revenue than he had in the last 2 years alone.
Wow, that's impressive.
Yeah. You know, but then unfortunately, of course, on the other side, we have other entrepreneurs, tech entrepreneurs that have had to shut down because the investors have backed down. They can't, continue running, the business costs. They don't have runway, and they have to shut down again in the same period of time.
So for those companies that have done well during this crisis, what is it that they've done differently for them to stand out or to stay afloat?
They have targeted the opportunities within the crisis. Opportunities like how do we distribute medical equipment or requirements to families, to frontline. So they've done. They've gone to where it hurts most, and they've been the solver or creating efficiencies at that point. We have a small startup called Minute 5. It's been doing food deliveries before COVID. During COVID, it was dealing with essential, services like food. So of course, it had to spike. So I think it was the focus around what is essential and what people will demand or will require, especially during this period of time.
How about on your part? How did this impact your business?
A lot of how we've structured our business is significantly different from how a typical incubator or accelerator structures their business. The Innovation Village is mostly an open innovation facility where we leverage the big community that we have to solve problems. But then we saw new opportunities coming up. For example, we launched the COVID Innovation Challenge with a couple of partners, and we got about 52 responses from entrepreneurs who are saying, here is how I'm contributing to solve the problem. And that was an initiative that we undertook.
Thank you so much.
Thank you for having me.
That was VOA's Paul Ndiho speaking to CK Japheth, CEO and founder of Innovation Village Hub in Kampala, Uganda. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.